Hello, and welcome to another episode of Mr. Naughton's Guided Lectures. Today we have a special 2-for-1, two PowerPoints in one lecture. I hope you're as excited as I am to hear about both eating disorders and mental illness. So we're going to start off with eating disorders, and then we'll dive into mental illness. And actually, this will springboard us into our lesson that we're going to have for the next few days about researching certain mental illnesses. So here we go. All right, the three eating disorders we're going to talk about are anorexia nervosa, a binge eating disorder, and bulimia nervosa. Eating disorders are defined as a mental disorder that reveals itself through abnormal behaviors related to eating. So it is not just about the food or eating the food. It is actually a mental disorder that the symptom is having problems with consuming or lack thereof with food. So the first eating disorder we're going to talk about is anorexia nervosa, or most commonly just known as just anorexia. And this is where the person does not eat enough food to maintain a healthy body weight. Some risks or some symptoms is extreme weight loss. Their heart rate and their breathing will get slowed down. They'll have dry skin, almost to the point of peeling and cracking. Lower body temperature. There will actually be growth of fine body hair on the body, because when the internal body temperature goes down, the body will react by actually growing body hair to try to keep it warm. If you understand how the animal kingdom works, basically animals use body hair to keep them warm in the elements. So the reason why humans don't have as much body hair as animals do is because we have advanced in our technology to be able to keep ourselves warm without the use of our body hair. So when someone's dealing with anorexia and they have a lower body temperature because of their low body weight, they will actually grow body hair all over their body. And also for women, they could actually lose their menstrual period, their menstrual cycle, which could cause complications with childbirth. Some possible causes that can cause anorexia: the lack of the chemical that regulates your mood in your brain. Troubled relationships can cause anorexia. Low self-esteem is a big indicator with teenagers in anorexia. Strong desire to please others and an attempt to control their own life. So what treatment can you have with anorexia? Hospitalization and mental therapy. There was a picture of a lady who is dealing with anorexia, and you can see how skinny she is. And the next eating disorder that we're going to be talking about is bulimia. This is uncontrolled eating, and they're called binges, followed by purging, which is either using laxatives to digest the food quickly and get rid of it through a bowel movement, or throw up the food. Some health risks and symptoms is dehydration, because when someone's throwing up and or using laxatives, a lot of excess water is leaving the body, causing the body to be dehydrated, and that can also lead to kidney damage. Kidney damage because of the lack of water, and the kidneys need and your organs need water to be able to insulate and function properly. When you are binging and then purging, you are getting not enough necessary vitamins and minerals. From all the throwing up, you can have an irritated throat, eroded enamel on the teeth, also because of the acid that's coming out of your stomach with the throw up, with people making themselves throw up. Scarred knuckles from sticking your fingers down your throat, and people will actually eat in private and then purge in private when they are bulimic. The possible causes are the same as anorexia, and again, the treatment is very similar: help from mental health professionals. Here are just some examples of somebody binge eating a lot of food at one time, and then someone sticking their fingers down their throat to purge. The last eating disorder we're going to talk about is a binge eating disorder. So, very similar to what people would do with bulimia, but just without the purging. So, this is an uncontrollable urge to eat large amounts of food. And what could happen is excessive weight gain, unhealthy dieting that could lead to diabetes, high blood pressure, and heart disease. Some possible causes could be difficulty with emotions and how food provides temporary relief. So, someone going through a lot of anxiety or a lot of guilt or a lot of depression, like it says, the other possible causes is they could be binge eating to subside their feelings or to make themselves feel better. Again, the only treatment is getting help from a mental health professional. And the people who have to worry about eating disorders the most are usually females. A lot of the percentage of people who have eating disorders are females, typically teenage and younger aged females. We will have a discussion about this and why this is. But typically, it's all comes down to body image and expectations from media and social media to look and feel and be a certain way, which is very unrealistic in any regards when we're talking about movie stars or models. So the next discussion we're going to have is going to be on mental illness. And this is going, like I said, this is going to be the springboard to our next objective for researching mental illnesses. What is a mental illness? It is where the individual either cannot cope with day-to-day living or the individual has a difficult time in developing relationships with other people. There are two types of mental illnesses, or two main descriptions. The first one is neurosis. This is a mental illness without much personality changes. You can maintain contact with social reality. This is less of an impairment than psychosis. It often is a specific behavior, like an eating disorder or a fear of something or an anxiety. It can also depression and obsessive compulsive disorder falls under this category, which you'll be able to research any number of these in our benchmark. And then the other description is psychosis, where a person has lost contact with social reality. This is a greater of the two impairments than neurosis. These examples is schizophrenia, which we've discussed earlier in lessons, bipolar disorder, and paranoia. Some causes of mental illnesses, there's three causes. The first one is biological, an actual physical or chemical change in the brain, either from a brain tumor, a stroke, a brain injury, genetic traits that cause changes in brain chemistry. Another cause of mental illness is psychological. There's actually no physical evidence of brain damage, but the illness could be caused by stress, emotional conflict, or some type of painful childhood experience that has never been brought up, that has been left to stay inside a person for a long time until a mental disorder or a mental illness could surface. And then actually the third cause of mental illness is environmental. Unfavorable surroundings, unfavorable conditions in surroundings. And the number one example is people living in poverty. The majority of those suffering from mental illness in this country actually come from extreme poverty. So it's something to understand and realize. And if you've ever been walking around the city of Chicago, or if you've ever been into a place where you have seen where there's an abundance of homeless people, you will see that the majority of them are suffering from mental illness. And it's not a surprise that people in poverty have mental illness and that they stay in poverty with their mental illness. It does not allow them to function appropriately with society, and it does not allow them to maintain and build good relationships with family or friends. They become alienated, they become addicted to certain substances, and they also cannot deal with the day-to-day management of life, of living. So we're going to talk about phobias because it's an interesting thing, because there's a lot of unreasonable fears out there, and that's what a phobia is. It's an unreasonable fear for something that sometimes can be explained either from a traumatic event, or sometimes can't be explained, or someone just has a fear of it. So acoustic Acousticophobia is actually a fear of noise. Androphobia is actually a fear of men. Neophobia is actually a fear of things that are new. Being a hypochondria, which is a little bit different from phobia, but a hypochondriac is a fear of having a fear of illness or thinking that they have many illnesses, or just being exposed to the world will give them many illnesses. Russophobia is actually a fear of Russians, believe it or not, and you can't use this as an excuse for not being good at taking tests, but testophobia is a fear of test taking. And I mean, I don't know who's not afraid of tests from time to time, but you can't use that the next time you either get a test in health class or a test anywhere else and say that you have testophobia, because you have not been actually diagnosed with it by a medical physician. Some other mental illnesses include dissociative conditions like amnesia or multiple personality disorders. And anxiety disorder can be brought on by worry or tension. An example of this is post-traumatic stress disorder, where people come back from a traumatic experience like war, and they have thoughts and feelings of the war either continuing, or people are still coming after them, or their lives are still in danger, and they can also suffer from flashbacks as well of them going back to when they were experiencing this traumatic event and believing that it's in actually reality right now. Obsessive compulsive disorder, also known as OCD, is urgent repetitive behavior. Washing hands multiple times a day, opening and closing doors multiple times before someone can walk through a door, turning the lights on and off several times before either the light stays on or the light turns off. These are just a few examples of obsessive compulsive disorder. A lot of people that have OCD or have obsessive compulsive disorder usually are people who have a problem with germs or have a problem with staying clean and being clean. And then obviously depression, which we've talked about at great length. The big D, major depression, cause fatigue, irritability, sadness, and we know now that it may become suicidal from depression. Bipolar disorder or manic depressive, we know that is low to high mood swings. And schizophrenia, this is definite psychosis. This is usually a chemical imbalance in the brain. This is treated with medication, the combination of medication and therapy. These are where people have delusions and hallucinations, voices in their head telling them to do or say or act certain ways. Paranoia is a fear of conspiracy, or a fear that people are coming after you or something is coming after you to harm you or harm others in some way. Paranoia is also a very real mental illness. So you're going to get a chance to research these a little more and actually become experts on being understanding of mental illnesses. So you're going to get a chance to dive in and research about 5 different mental illnesses, give me definitions, give me examples, and give me things that make sense to you. So if you're listening to this, that is going to be your assignment for the next few days when you're working on your reinforcement, and it's going to be turned in before the end of the week so we can have it before we get done with our test. So there you go. There's some eating disorders and some other mental disorders that we're talking about that are important for us to understand and research and find out, because especially with the ones that are hereditary or genetic, that we need to know, and we need to do our research and be a good healthy consumer. Ask our parents, ask our guardians, are we susceptible to any of these illnesses? Did any of our family members have it? So we know to get either checked out or to be aware for the signs and symptoms if it's coming our way. So until next time, again, this is Mr. Naughton. Thank you for listening, and we'll see you in class.